Now we want to get the latest updates from the head of the St. Louis Metropolitan Pandemic Task Force. Dr. Alex Garza is also the Chief Medical Officer for SSM Health. Joins us live this afternoon. Dr. Garza, I want to start with that big news today, the Pfizer announcement on the encouraging results of a vaccine and their research. When should we expect that to be distributed in St. Louis?
Yeah, nobody knows an exact date yet. So what we're hearing, the earliest that it would arrive would be around a December timeframe, so early to mid-December. I think people also need to recognize that it's not that, millions of doses will arrive in St. Louis on any given date. These will come in small batches and they'll be distributed according to a tiering schedule. And so it's going to take many, many months to get a majority of the population immunized against COVID-19.
And you mentioned that tiering schedule, so who would or should be the first to get the vaccine when it does arrive?
So that's typically developed by the Advisory Committee for Immunization Practices out of the CDC. They're on schedule to release their recommendations later this month. Most people believe that healthcare workers will be first in line, and then it'll be first responders, and then people at high risk for COVID-19, and then the list will continue down, people that work in critical infrastructure, things like that. But healthcare workers will most likely be at the front of the line.
Okay, President-elect Joe Biden announced an advisory board of his own today to deal with the virus. If you were advising that task force, what immediate action would you ask them to take?
Well, you have to recognize he doesn't become president for another 70 days. So there's not a whole lot he can do right now other than advise, right? So advise the American people. And I think he's doing that now with advising people to wear masks, socially distant, not gather in large crowds, things like that. But even when we get to the January timeframe, by then more vaccine will be coming about. The policy changes there's not any huge shifting things you can do with policy changes right now. So I think he's taken all of the appropriate steps by advising people with those mitigation strategies that we all talk about.
Is there anything that you would advise for him to do?
Other than what he's doing right now, there's not a whole lot else I think he can do. Certainly, they should talk about, the stress on the hospitals. Whether that would mean, if that continues on until January, what would that mean for the country? Do we need to do some sort of partial shutdown, or at least decreasing the amount of people that are out circulating and interacting with each other? So those are the various things. But by and large, this is very simple stuff. It's wear a mask, socially distance, and not gather in groups.
And I want to dive into the hospitalization record that we set. We know case levels are also far beyond where we were when the pandemic started. Also, in your afternoon task force update, you did mention that this is not the time to ignore the proven measures of stopping the spread and allow businesses to stay open. Could you elaborate on what that means for businesses, and what about schools that are reopening?
Yeah, so there's a lot of data that shows that schools aren't the primary driver for transmission. Most kids are pretty safe when they're at school because, they wear masks, they're able to socially distance, all of those things. And so there's a lot of good data that support that. So my intent of saying and allowing businesses to stay open is really incumbent upon how we act as a community. So if the majority of people will wear a mask, practice social distancing, not gather in those informal gatherings, you can interrupt the transmission. And that will allow businesses to stay open. But if we can't follow those really simple rules, the virus will continue to transmit, we'll continue to see more hospitalizations, and unfortunately there'll most likely be some policy changes if we can't get it under control.
And as we're continuing to post record numbers, you talk about the stress that right now the pandemic is putting on the hospital as we're dealing with these new waves of new cases. Is there any point or metric where you can see where we would need to go back to a stay-at-home order?
So, we talk about this quite a bit, and there's really no one sort of single metric. We already know that we're under stress as a healthcare system. We try and look for ways that we can increase our capacity to take care of patients. So whether that is dialing back on our elective procedures or other sorts of ways that we can increase capacity. But that, of course, has a limit. So we know we're at our capacity limit for beds right now. Now, is there a way that we can free up more capacity or do other things so that we don't have to resort to some of these extreme measures? We're not there yet, but if we continue on that trajectory that we're on right now, I think we will quickly be there.
All right. Always a good afternoon when you can answer our questions, Dr. Garza. We do appreciate it. It will take everyone to get us through this pandemic. Thank you.